All right, thank you, Sarah. Thank you very much for the invitation. I'm going to share my screen to get us started. Just checking everything is fine there on the screen. Right. As she introduced myself, I'm Dr. Maurice Haynes. I'm from the University of Cape Town, and I want to talk to you today about the anatomy of COVID-19. So just to give you a brief introduction, there's a mugshot of myself. I'm currently doing this webinar from sunny Cape Town. So there's Table Mountain in all its glory. I've got an MSc and a PhD in zoology. I worked on fetal alcohol syndrome using gallus, or the chicken, as an animal model to demonstrate that. MBA in project management and strategic management. Universities where I've worked is University of Pretoria, University of the Western Cape, Queen's University, Belfast, and currently University of Cape Town. I'm happy to say that I'll be joining Ulster University in May of this year, and I'm looking forward to joining the new medical school with graduate entry medical students. Currently, I'm in forensic science. I do forensic science research and teaching, as well as research in forensic science education. I have in the past at medical schools done research in medical education, specifically professionalism amongst medical students and doctors, and I've got 20 years of experience in teaching gross anatomy. So for today, just going through, I'm going to introduce a little bit. I've got a little video clip I want to show you introducing the COVID-19 and how it enters the body. But the idea is for us to go and look at the different organ systems and how it is affected and how the symptoms come about, such as the breathing difficulty we know about, the cardiac problems, the shortness of breath. So we'll be working through the different organ systems, and I've been touching on to a couple of other systems as well, apart from the major ones that I've mentioned there, and then we'll have a little concluding session at the end. So just as an introduction, we know that COVID-19 was reported in Wuhan province, or in Wuhan in the Hubei province in China. And in January, it was identified that this is a novel coronavirus. We've known coronaviruses in the past, but this was a novel one, a new one. And there was declared a public health emergency of international concern. And it was clear that people were infected when they come in contact with infected people or with contaminated surfaces. And the primary site of infection was the nose and mouth. But now later on, we know it's basically the eyes, nose and mouth. So all of those areas that's lined with mucus, with a mucous membrane. So this is an interesting map. It's a tracking map that you can follow. There's the website there that you can look at the current statistics. So this is the Johns Hopkins University. The map on the right shows you some of the outbreak there in China, and you can see there's some red dots there that would have been the spreading of the virus through air travel there in Australia and in America. But here in the bigger map that you can see, it's yesterday afternoon, the current, whoops, let me just go back. The current status was that we had almost 110 million cases globally, and we had 2.5 million deaths globally. The nice thing about this Johns Hopkins website is that you can go and click on any area that interests you. For example, there I've clicked on Northern Ireland, and yesterday afternoon it said that Northern Ireland had 109,000 cases and just over 2,000 deaths. And so you can look at any other region that might be of interest to you. So you can see how it has spread from the original China outbreak to where it is currently. So what follows now is a video clip that will show you a bit more about how the virus enters the body.
This is SARS-CoV-2. It belongs to the family of coronaviruses named for the crown-like spikes on their surfaces. SARS-CoV-2 can cause COVID-19, a contagious viral infection that attacks primarily your throat and lungs. What actually happens? SARS-CoV-2 can cause COVID-19, a contagious viral infection that attacks primarily your throat and lungs. What actually happens in your body when you contract the coronavirus? What exactly causes your body to develop pneumonia? And how would a vaccine work? The coronavirus must infect living cells in order to reproduce. Let's have a closer look. Inside the virus, genetic material contains the information to make more copies of itself. A protein shell provides a hard protective enclosure for the genetic material as the virus travels between the people it infects. An outer envelope allows the virus to infect cells by merging with the cell's outer membrane. Projecting from the envelope are spikes of protein molecules. Both a typical influenza virus and the new coronavirus use their spikes like a key to get inside a cell in your body, where it takes over the cell's internal machinery, repurposing it to build the components of new viruses. When an infected person talks, coughs, or sneezes, droplets carrying the virus may land in your mouth or nose and then move into your lungs. Once inside your body, the virus comes in contact with cells in your throat, nose, or lungs. One spike on the virus inserts into a receptor molecule on your healthy cell membrane like a key in a lock. This action allows the virus to get inside your cell. A typical flu virus would travel inside a sac made from your cell membrane to your cell's nucleus that houses all its genetic material. The coronavirus, on the other hand, doesn't need to enter the host cell nucleus. It can directly access parts of the host cell called ribosomes. Ribosomes use genetic information from the virus to make viral proteins, such as the spikes on the virus's surface. A packaging structure in your cell then carries the spikes in vesicles which merge with your cell's outer layer, the cell membrane. All the parts needed to create a new virus gather just beneath your cell's membrane. Then, a new virus begins to bud off from the cell's membrane. Now, with the virus spreading in your body, how can you develop pneumonia symptoms? For this, we'll have to look into your lungs. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon. And when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries, and then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. In a healthy body, hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you might expel them by coughing. Normally, cells of your immune system attack viruses and germs that make it past your mucus and cilia and enter your alveoli. However, if your immune system is weakened, like in the case of a coronavirus infection, the virus can overwhelm your immune cells, and your bronchioles and alveoli become inflamed as your immune system attacks the multiplying viruses. The inflammation can cause your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs. You could develop lobar pneumonia, where one lobe of your lungs is affected, or you could have bronchopneumonia that affects many areas of both lungs. Pneumonia may cause difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, and fatigue. It can also lead to more serious complications. Respiratory failure occurs when your breathing becomes so difficult that you need a machine called a ventilator to help you breathe. These are the machines that save lives and that medical device companies currently ramp up production for. Whether you would develop these symptoms depends on a lot of factors, such as your age and whether you already have an existing condition.
Right, back to me. So basically what that video showed is how the virus can infect the lungs. So what is clear and what is known is that the virus will travel through the body. It will engage with host cells. So this is literally what it shows here. There's spikes on the virus, and it will react, it will engage with that host cell, which is called the ACE2 receptor. And that spike will fit neatly into that receptor, and it binds to that cell. So it's like a lock and a key, or a key and a lock rather. So with that spike, it can open that receptor and it's allowed into the cell. So it binds to the cell, it invades the cell, and when it's inside the cell, it uses all the material inside the cell to make new viruses. New viruses will leave the cell and it will infect surrounding cells. And that way it lands up in the bloodstream and it will travel through the body. So we've got a high number of these ACE2 receptors, let's call it the locks, in your lungs. That's the primary site of infection, but you also have these receptors or locks in different areas of the body, in the cardiovascular system, in the digestive system. But the moment something unknown to the body, such as the SARS virus, the COVID-19 virus, enters the body reacts by saying, here's something weird, this is something I don't want in my body, and it will create an immune response. It will try and get rid of it. So the ways that it can react to that is to have different responses. It's got different teams. It's almost like having different ways of dealing with this unknown, unwanted. So the first group of cells that we get is the cell group A. Those are the ones that recognize the viruses and goes and kill the viruses. So it sees the virus, it sends a message to the brain, here's something we don't want. The brain sends a message to the immune system, and the immune system starts up and it will kill the virus. So there's a little bit of a delay. It's almost like here at the bottom, there's a motor vehicle accident on the road. Someone needs to phone the emergency services, and it takes a while before the emergency services get to the accident site. The other group of cells, cell group B1, they actually attacks the infected cells. So now the virus have opened the cell with a lock and key, and it's inside the cell. So what it does is it kills that infected cell, and it will prevent the virus from popping out and infecting and multiplying other neighboring cells. So that's almost like you have a tanker exploding. That's the main thing. So the fire brigade needs to do is kill the flames, the virus. But the flames can jump to other neighboring things. So now you have to go and extinguish the flames in other areas, so inflame in the cell. Your third group of cells is the cell group B2. So what they do is they produce antibodies. And that antibodies recognizes the virus and it binds to the virus. And that way there's a much quicker response to a quicker way that the immune system can respond. So it responds faster. It's almost like the bottom here where you have a highway patrolman or policeman patrolling the road, and they will come upon an accident much quicker and will have a quicker response and emergency response in the event of an accident. Okay, in the same way, you can also use different ways of describing that. It's like a burglar coming up to your house. If you recognize the burglar, you can prevent a burglar from entering your house. But if the burglar has a key and you haven't recognized the burglar will come into the house. So now that it's in the house, what can you do? You can lock the burglar in one of the rooms. That way you can prevent the burglar accessing the rest of the house. And how can you remain vigilant? I have these antibodies. You can put cameras up in your house that can identify a burglar much quicker. So these are ways that you can explain what happens when a virus enters the body. But one of the things that happens is the moment your immune system picks up that it needs to fight off a virus, it produces and it releases what we call cytokines. And the cytokines will regulate your response to infections. So what we have with COVID-19 is that there's a specific cytokine called the pro-inflammatory cytokine that's produced. And you will then have a heightened immune system and inflammatory response in your very severe COVID-19 cases. We also unfortunately have what we call a cytokine storm. That is when your immune system overreacts. So it's almost like you've got a group of soldiers that is there to defend, but suddenly goes haywire and they are over enthusiastic. So what you get in a cytokine storm is that your immune system produces these cytokines in excess, and instead of just attacking the virus, it starts attacking healthy tissues. In that way, it can cause damage to blood vessel walls, which means the blood vessel will start leaking. And that means your body will now start clotting these leaking blood vessel walls, and you have excessive clotting, and those excessive clots can then choke blood flow. Okay, so keep in mind this cytokine storm that you can get. So now we're going into the different systems. So let's go into the respiratory system. You saw that very nice video, showed you a lot of things. I just want to point out to you that your respiratory system is divided into an upper and a lower respiratory system. The respiratory system is where air is taken into the lungs, and then there's gas exchange in the lungs. So you take in oxygen from outside and give it to the blood, and then the blood gives off carbon dioxide, and it is expelled when you expire, when you breathe out. So the upper respiratory tract, which is now the nose, mouth, pharynx, larynx, and trachea, that's the path to get to the lungs. And in the lower respiratory tract, you've got your lungs, but you also have all these other pumps that help the lungs to inflate and deflate. The lungs are where the gas exchange takes place, but the pump will be your chest wall, your muscles and nerves that allow the pump to work. So any failure in any of these parts can lead to having a difficulty breathing. And what we find is that the basic building stone of the lung that allows the gas exchange is what we call these little alveoli. The alveoli is like little balloons, and it's covered with blood vessels. And because it's so thin, the walls, air can go in and out between the little balloon and the blood vessels around it. So what you get in times of pneumonia is that the alveoli, which is normally filled with air, starts filling with fluid. So just to summarize then, same way, COVID-19 enters the body, and now you've got loads of these receptor cells in the lungs and the linings of the lungs. The virus attach onto these receptors, and if it's in the upper respiratory tract, it will incubate there. It can incubate for 2 to 14 days in the upper respiratory tract. And that's when you have symptoms like coughing, sneezing, a sore throat, a dry cough, fever. We'll explain those, how that happens just now. But at some point, the virus will reach a specific volume. And when it gets to that volume, it is released into the neighboring lung cells and into the bloodstream. Just to remind you, in that video, we saw it, that coughing is that reflex action that you have to force the air quickly out of your lungs. And that's normally because there's some other irritant in the lung and in the pathway. So now the virus is now in the lower respiratory tract. So there you've got your alveoli. It's a normal, healthy alveoli. It's a thin membrane, and it's surrounded by blood vessels. And you can have a clear exchange of carbon dioxide and oxygen between the little balloon and the blood vessels around it. But now one of the ways that the body fights off infection is to produce mucus. And what you get is the moment the virus infects these alveoli, you'll have that the wall thickens. The wall will thicken and it will start producing mucus. And now the problem is your little air-filled balloon is now filling with liquid, filling with fluid, and that makes breathing difficult. So the moment you start having difficulty breathing, it means you have difficulty with oxygen reaching organs, and then you have a shortness of breath. So your lungs don't function at their full capacity because of the fluid, and you have these additional symptoms coming of headache, dizziness, diarrhea, vomiting, and then the major one is the shortness of breath. You literally feel as if you've run a marathon when you try and walk 20 steps. So this is then where it helps to put the person on oxygen to make sure they get more richer air, and that you supplement their air intake with richer oxygen. In the aged and the elderly people, of course, your respiratory system already becomes compromised, and that means you've at an increased risk. You also get to the point where your muscles and your lung function is so severely affected that you can't breathe on your own anymore. And that's when they put you on the ventilator so the machine can do the physical action of breathing in and out for you. Right, so in brief, the big problem with the respiratory system is all your organs need oxygen. And the moment you have a limited oxygen supply, it starts getting a snowball effect. So the cardiovascular system consists of the heart and then all the blood vessels coming out and going into the heart. Same way, COVID binds to the receptors, and the receptors is on the inside. It's the endothelial lining of the heart. It's on the endothelial lining of the blood vessels. So the moment it enters that endothelial lining, your body's defense is initiated. You've got the immune system responding. So there's inflammation and there's cytokine production, and your white blood cells get released to go and fight this infection, this thing that you don't want in your body. I just want to mention here that, of course, different people react differently to the virus, and it depends on your existing risk factors. So individuals with hypertension or diabetes already have an existing vascular injury. People that are obese or the older people have got a reduced metabolism, and that means your immune system response is slower, slows down over time. And then you have some people already on immunosuppressors. So individuals on receptor inhibitors or receptor blockers will then have an increased risk. Okay, so let's just talk about the heart. Remember, the heart pumps the blood. It's a muscle. It needs oxygen. And then the virus can affect it in different ways. So first of all, when the heart picks up that this virus is in the area, it will produce vesicles to trap that virus. And the moment it produces these vesicles, that can cause a constriction, and that can limit blood flow. So the moment blood flow is limited, your blood pressure is affected. So now you must regulate your blood pressure. Suddenly, the heart must work harder. It must pump stronger to get the blood to the periphery, to your big toe and to the tip of your fingers and the top of your head. You can also have that injury to the endothelial lining. So what happens is the moment your blood vessel is cut normally and there's bleeding, your body will start with a clot formation. It will send the little soldiers to the clot, to the cut, and there will be clotting, and that will stop the bleeding. That's normal. And usually over time that clot disappears again. But now with this increased injury, lots more cuts, lot more bleeding of the blood vessel wall, you have a overproduction of blood clots. So clotting increases because the blood vessel wall gets permeable, it leaks out. The other problem you might have is that the heart wall itself has a problem. It gets blocked. So the heart muscle itself gets affected, and you have cells that can die. You also have the blood vessel can be blocked, and then you have myocardial infarction, which means that you can have a heart attack. You can also have your heartbeat, your rhythmic heartbeat, getting thrown in disarray. So there's an abnormal heart rhythm, and you recognize that the heartbeat is not regular. So all in all these, the extra clotting, the abnormal heartbeat, the blocking of arteries around the heart, the fact that all these clots can block blood vessels, and especially if it blocks the blood vessels going up to the brain, where you can have a stroke, or the heart muscle itself being injured, that all leads to the fact that the heart doesn't pump adequately. It doesn't get enough blood, and that unfortunately leads to the heart needing to pump harder. So it's a decreased supply of oxygen to the organs. You feel tired because your organs don't get enough oxygen, your muscles don't get enough oxygen. So you're feeling tired and you are in discomfort. Your heart needs to work harder to pump more blood, and that leads to fatigue, it leads to pain in the chest, it leads to shortness of breath. Because for the heart to pump, you need oxygen. The heart is a muscle, so it needs oxygen to pump harder. So that gives you shortness of breath. The whole time you're feeling you're not getting enough exercise, so you're starting to become short of breath. And subsequently, with the heart not pumping enough oxygen to the periphery, you have organ failure in different organs. You can have a heart attack where the muscle of the heart itself doesn't get enough oxygen, and that can result in death. Okay, so here the picture on the right just shows you all the different types of things that can go wrong with the heart. You can have plaques developing, but the main things is you can have myocardial infarction. That means a blood vessel is blocked at the heart and the cells around it dies and you have a heart attack. Or you can have heart failure, where the vessels of the heart itself, the lining is not adequately, it's not working, or the heart itself, the muscle of the heart gets infected, or you can have this arrhythmic heartbeat. What is important is that when people recover, and your heart is a major organ, so when people recover from COVID-19, they are always at risk. They can be at risk, not necessarily, but they can be at risk for myocardial inflammation. They can be at increased risk for stroke. There can be fatty compounds in the blood. Their arteries can clog. They can even have destruction of bone tissue. So there's a very important need to monitor patients even after they've recovered from the infection. Okay, stepping away from the heart. Now we get to the nervous system. The nervous system, of course, is your brain and all the peripheral vessels. Now, I know the slide is a bit busy, but let me talk about how the nervous system can get infected. There are two ways that the nervous system can get infected. The one is the virus enters the nerves directly, or the virus is in the blood and the blood is going to the nervous system and then brings the virus to the nervous system. So the one I wanted to show you right here at the top, it shows you the nose and it shows you the olfactory tract, which is the main nerve to the nose that allows you to smell. And you've got lots of little olfactory nerves hanging down. This is an animation or annotation. It's not how it looks in real life, but you can get the message that there are nerve endings dangling down the base of the nose, and that's where smell gets picked up. So that's one way of getting to the nervous system, that it goes straight into these nerves where it is exposed to the virus. The other one is it goes in the blood. Now, to prevent viruses in the blood, foreign bodies, viruses, getting to the brain, you've got what we call a blood-brain barrier. It's like a wall between the brain and the blood. And unfortunately, this brain-blood barrier can be overcome by viruses. So it can go through two ways. The one is this transcellular migration. This is the one typical that we said of. The virus hooks onto a receptor, it goes into the cell, it multiplies, and then it goes out of the cell again, it ruptures out of the cell, and this time it goes on the other side of the cell into the nervous system. Or sometimes you get that there's a small gap between two cells of this barrier, the bricks in the wall, and it can go through that, let's call it the cement that keeps the bricks together. The third way it can go over the blood-brain barrier is through a Trojan horse. And that's like a macrophage. That is a structure that's allowed to go through the brain barrier, blood-brain barrier. And in this case, the virus uses it as a Trojan horse and then hooks up onto that and goes through to the brain. So that's the three main ways that the virus can go and enters the brain. But you know that the symptoms that we have is the two that I mentioned here. It's the lack of smell and the lack of taste. So what I just wanted to, or the loss of smell and taste, is just to show you that there are nerves, like you have here in the nose, also then nerves nerve cells in the tongue that can be affected. So the nervous system is much more complicated than that. You've got loss of smell, and I've spoken about the virus entering the nerves. Now, there are some studies that say that the virus don't actually go into the nerve cells, but it first goes into the mucous lining in between the cells and then enter the nerve cells. You get headaches. Now, what happens with headaches is you've got low oxygen in your tissues and in your brain, and that sends a message to your brain, to your blood, to get more blood to the brain, so pump harder, and it gives a message that your blood vessels must expand. So you've got widening of vessels and more blood coming to the brain, and that causes swelling, and that is where the headache comes from. Stroke I've spoken about, you have a blood flow that's restricted, so a blood vessel going up to the brain it gets restricted with abnormal clotting, and that blockage in the blood vessel will cause a stroke. Encephalitis is when you have this inflammatory response, there's an invasion of the brain tissue, and you have this cytokines being released, but then what you get is that you have the cytokine storm. You have too many of those cytokines then attacking not just the virus, but also healthy cells. And you've got other problems as well with the nervous system. You've got disorientation, behavioral problems, short-term memory loss. It's all to do with this heightened inflammatory response. So just to get back to you, that when we say smell and taste is at loss, just remember when we taste food and we perceive food, it is to do with smell and it's to do with taste, but it's also to do with what we call oral kinesthesis. It's that when you put food in your mouth, it touches the tongue, it touches the sides of your mouth, and there's temperature that you recognize. So all of those things give us the sense of taste and smell, and then obviously smell. Okay, one thing I do want to touch onto in the nervous system is the hypothalamus. The hypothalamus sits here at the bottom of the brain. There you can see the brain. Oops, let me go back. And you can see the hypothalamus there in the brain. It's very important because it controls hormones that's involved with your immune system. It's rich in these receptor cells, and it's linked to other parts in the brain. It's linked to parts of the brain that controls fluid balance. It links to heart control, cardiac control, respiratory control, but it's also linked to those areas that recognize smell and taste. So what you get when that brain barrier is overcome, your body reacts with recognizing that there's inflammation, and there's inflammation of the nerves and the blood vessels. There's increased cytokines being given off, and that activates the hypothalamus. The hypothalamus kicks in, and one of the things the hypothalamus does is it increases your body temperature, because it knows that a lot of viruses are sensitive to heat. So when you have this fever, your body temperature increases, and it's hoping to kill off the viruses because it's sensitive to heat. Other things that we do get, for example, pink eye, conjunctivitis. So some people do get pink eye. So the virus infects this conjunctiva. The conjunctiva is the lining of the white of your eye and also the bottom of your eyelid, the back of your eyelid. So when you've got pink eye, your eyes are red, it's swollen, it's itchy, but you can see here from the man rubbing his eyes, one of the ways that you get the virus into your eyes is by touch. You touch surfaces where the COVID virus droplets are still active, and then you touch your eyes, goes into the mucous lining of the eyes, and that's how you get infected. And it can then move from the conjunctiva to the other parts of your nervous system. So just remember, the mucus area, the dangerous area, is our eyes, nose, and mouth, anything lined with a mucus lining. So I am cognizant of the time, but I'll just go through the digestive system. What we have in the digestive system, the COVID virus comes in through the mouth, it goes down to the stomach, and in the stomach, we've got what we call good bacteria. The good bacteria is in balance, and the moment COVID hits the stomach, it goes out of sync. So we get excessive inflammation of the stomach. And that's where we have then symptoms like vomiting, the body is picking up that there are toxins in the stomach. Things are not in balance now in the stomach. And then you have this reflex contraction of the diaphragm and the abdominal muscles because you want to empty the stomach content. You also have diarrhea, and that's when the large intestines and small intestines don't absorb enough fluid and your bowel movement becomes watery. Nausea, postnasal drip causes a lot of the nausea, and you also have abdominal pain. It's mostly to do with gas and muscular pain. What they did find, however, is that you could still pick up the COVID-19 virus in the fecal matter after it's been cleared in the respiratory tract. So when you don't have the picking up the virus in the lungs anymore, however, it can still remain in the digestive tract. The liver, I'm not going to talk about much. It's just to say that the liver can be affected in different ways. Again, you've got that cytokine storm where there's a hyperinflammation response. So the liver itself can be the inflammation reaction, cytokines, or it can be the blood vessel going to the liver that restricts it, and then you have cell death. It can have existing liver disease that can get exaggerated. And then also sometimes you can get liver damage because of the medicines being given to you. So antiviral drugs, antibiotics, and steroids can also cause liver damage. But it is important to know that if you've got a pre-existing liver disease, like a chronic liver disease, hepatitis, cirrhosis, you may be at an increased risk of COVID and also at a higher risk, of death should you get COVID-19 virus. Urinary system. The urinary system is how we get rid of lots of salts and unnecessary waste products in our body. It gets collected in the kidneys. It goes down the ureters to the bladder and gets expelled through the body. So what we have is a lot of patients in the hospital get acute kidney injury. So that's a sudden episode of kidney failure. It can be within a few days, within a few hours even, and you pick up a lot of protein in the urine. It's so severe that a lot of people require dialysis. So again, what happens is there's a lot of receptor cells in the kidneys, and the virus targets the kidney cells. So this cytokine storm, the overreaction that you can get, your immune reaction, can then cause damage to the kidney cells, and it can do it in the kidney tubes, in the kidney blood vessels, and it can do it in the glomerulus. The glomerulus is a small little area in the kidney where all these toxins get exchanged and goes from the blood into the tubes of the kidney and then eventually out into the urine. So a big problem, of course, is when the blood vessels to the kidneys get restricted. There's a lack of oxygen, and then it goes into, and that's to do with the increased blood clotting, and that can then cause septic shock. So you have this buildup of waste products in your blood because it can't go to the kidneys, it can't get out, and that will cause the septic shock. One of the things that picked up is that it can persist long after your recovery from COVID is articular joint pains and muscular pains. It's all to do with the viral inflammation. So when you have inflammation, the virus attacks the cells and it gets inflamed. It will attack the joints, and that will cause excessive fluid in your joints. So your joints are stiff, it's swollen, and it can then also target muscle tissue and cause muscle tissue damage. So that stiffness can cause pain, and that's where you still have the inflammation. Also, what can happen is the blood vessels to the joints and the blood vessels to the muscles can get restricted. And remember, when there's a clot, all the cells around it will die because it doesn't get blood. Blood doesn't go through, and that causes cell death. And then, of course, if you're bed-bound, you're hospital-bound, you might not be using your muscles that often, or you might be obese, or you might be, as I said, bed-bound. Then you can also, from disuse, get muscle atrophy or muscle wasting. This is an interesting one. Skin manifestations. So a lot of people have rashes, patchy rashes on the skin, and that's to do with the capillaries. The capillaries, that's the smallest type of blood vessel, they become inflamed and their sides burst, and the blood flows out of the capillary into the surrounding tissue, and that causes those red patches. But the specific one I want to mention is this COVID toe. So there's a picture of COVID toe, and you can see the red toes, red patchy toes, and it's similar to chilblains. So it happens on it develops on the fingers and toes when the capillaries contract in cold and then expand rapidly when they warm up. And then it means they rupture and the blood flows out. So that can be very sore, it can be sensitive, itchy, painful, and it feels as if it's burning. And when it starts to heal, you can see here at the bottom, it starts to crack and it starts to peel. But what is interesting with the COVID toes is that it's picked up with the younger patients. And sometimes it can be the only symptom, the only sign of COVID. And sometimes it's the first sign. And I think what happens is that a lot of the ACE receptors aren't well developed in the youth. And one of the first places it gets well developed is the upper respiratory tract. So they think what happens is the upper respiratory tract picks up the virus and there's a quick immune response. And that quick and brisk immune response results in these capillaries on the periphery, your fingers and your toes, bursting. Okay, so now to conclude, the COVID-19 virus can affect several organ systems, but it differs from person to person. One person can have pre-existing conditions and one person can, the physiology differs from person to person. But as in what I found already, people with comorbidities, diabetes, old age, the elderly, you are more at risk, higher risk to succumb to COVID-19 infection. The manner of treatment is also important. It may be influenced, the manner of treatment may even affect the severity of the infection. And remember now, if you're already on medication, there are obviously some medications you can't be without, you need to continue with that, others need to be adapted. But what is also important is that finding that they still pick up the virus in the fecal matter. So that means the virus can remain in some organ systems long after it's been killed off in the respiratory system. And remember, that is also a way of then transferring the virus. So you have to maintain your hand wash, distance, mask at all times. So I'm going to thank you. If you want references of where I got my information, by all means, send me an email, maries.haynes@uctacza. I had to get in some forensic entomology, which is my field of forensics, to say if you quit breathing, we'll find you. Thank you.